Hello everyone. Welcome to this YouTube channel focused on education prior to and throughout the process of knee replacement. The YouTube channel is entitled A Patient Proactive Approach to Knee Replacement, and it pairs with a book that I have authored, which covers a number of different topics. In this overview video, we will go over many of them. It is really designed to pair with the book, so I encourage you to look for it. It's currently available on Amazon Kindle, Apple Books, Barnes & Noble, and several other sites. It is published by BookBaby. I would recommend the e-version. The e-version has hyperlinks, both internal and external, that allow you to, without leaving the actual text of the book, see some exercise videos that are also at the end of this website. In addition, it's a reference type book, which allows you to read specifically on topics that apply to you. For example, if you are a diabetic and you want to learn about how diabetes affects complications, there is a hyperlink after a short read that goes into a lot more detail, and at the end of that detail, you can go back to the list of other medical topics. This is present in a couple of chapters of the book, and I'm hopeful that it makes it more readable so that you can read about what applies to you or what you're interested in. So onwards. I'm David Graybill MD. I'm an orthopedic surgeon that retired late in 2023. The focus of my practice for the last 20 plus years has been on knee and hip reconstruction. I have a lot of experience with this. I've also been a patient. I've had both of my knees replaced about 2 years apart, as well as a hip replacement earlier this year. This video is being posted in October of 2025. I was a member of a large private practice group in the Indianapolis area. The name of the group is Central Indiana Orthopedics, and if you're in the Indianapolis area, I have a number of ex-partners who provide excellent care for patients, and I would strongly recommend them. I would remind you that this book is about education and advice. It's not for me to take the place of any surgeon. I do list a lot of opinions of my own in here, but most of this book is based upon literal guidance and designed to help you work with your surgeon and medical physicians during this process. So I've done many thousands of hip and knee reconstructions over my career. Again, I've had some, and as I retired, I felt like I still wanted some connection or way to help patients. One of the things I found difficult to fully implement in my practice, and I think this is pretty universal, is it's very hard to, during a patient encounter, spend enough time with a patient that they can truly understand what we would like to transmit as far as information. Number one, patients are nervous. They forget a lot about what we talk about the minute surgery's offered, and number two, there just isn't the kind of time to offer the level of information, for example, that's in this book. So if you want to have kind of an active participation in your knee replacement that you're considering, you want to know more about the background and how to approach it, I strongly recommend this. I've looked through the literature. There are a number of books out there, obviously, on knee replacement, but they mostly focus on surgery and recovery. This one covers a lot of preoperative issues, and there's two very unique parts of it. One is entitled optimization, which we'll talk about shortly, and the other is about patient satisfaction and outcomes, which again is not addressed to my knowledge in patient literature. It's really in the orthopedic literature for surgeons. So onwards again. I plan 8 to 10 short videos that might grow, so don't hold me to that. The book is really designed as a reference, so it is readable, but designed to go back after reading it to go on to focus on specific topics that may apply to you. I have a number of topics prior to surgery, and we're not just talking about recovery. And really, I think what's unique about the book is, again, how to prepare yourself for the operation in terms of reducing risk of complications. Complications occur. Following these recommendations doesn't eliminate the chance of a complication, but it does reduce it. And there are lifestyle, medical, and physical issues here. So this is one of the unique aspects of the book and our talks. So early on, I'm just going to cover some of the topics in the book. We discuss what is arthritis. We overview terminology and x-rays. I list a lot of non-surgical options and their level of efficacy in the literature. We define a knee replacement, both partial and total, explain really what it is. I placed, actually the first video I'm going to do after this overview is addressing anxiety prior to surgery. This was prompted by a physician friend of mine who called me the day before she was having a hip replacement and had a number of questions, and that led me to think back upon my 3 major surgical events with knee replacement and hip replacement, and how I addressed the apprehension and anxiety and some strategies for that. And then lastly, there's some advice on picking a surgeon you're comfortable with. I think it is important to choose a surgeon that does a lot of knee replacements so that they aren't just an occasional knee surgeon. And then obviously you want to have a lot of trust in your surgeon. Personal recommendations from friends and family are helpful, but like everything in life, the more you do, the better we get at things. So high volume is quite important, and that's also important in the center, and there's documented literature in the book explaining this. Here's the first of the truly unique things about this that are within this book. Optimization is the topic. Optimization is factors that influence complications and outcomes. And I define them into 3 categories: lifestyle, medical, and physical limitations. And I go over this in detail in the book. And many of these things are improvable or modifiable, thereby improving your chances of avoiding complications like wound problems or infection, and being better prepared physically for surgery to prevent some problems during recovery. So that's, I think, very unique in the patient literature. It is and has been a topic probably for the last 10 years in the orthopedic literature. I spent a lot of time with this topic. I have a great interest in it, and I hope you find it very interesting as we move forward. Next, I go over the surgical event itself. We discuss the day of surgery, kind of a list of what to expect, what's going to happen, priorities, things like that. And then we move into different timelines. I categorize them day 1 through 3, 3 through 14, 2 through 6, and 6 till recovery, as each one of these has a little bit different emphasis of priority and things to worry about. And I break it down into pain management, how to get motion, how much activity to do, general expectations. Recovery is an interesting topic in that I've had 2 knee replacements. I've got probably 1,000 or more patients where I did both knees at different times, very rarely on the same day. But almost always the recovery in the same patient with the same surgeon, the same anesthesiologist, the pathway to recovery is different from knee to knee. And that's kind of unique and not predictable. So I think this is very helpful as far as general guidelines and priorities to help people get through things. After this, the next section, I talk about a number of specific issues. Maybe you have a draining wound or a wet dressing. you're struggling with pain management, you're not sure what to do with narcotics, when to use them, when not. Are you supposed to use them as directed or how? Let's talk a lot about range of motion and include exercises. Range of motion is the earliest priority after knee replacement. If you don't get it early, you won't do as well or get as good a motion. And it's far more important than how much you do. We then talk about swelling and stiffness, which are the enemy of good range of motion. Elevation and ice are actually critical tools in the recovery period. And activities, although we need to do activity, if we do too much, we tend to drive more swelling and pain and lose range of motion. If we do too little, then that's obviously problematic also. Moving on, the second general area that I think is completely unique in the patient literature to date is outcomes. Outcomes are a driver in all of medicine currently. Payers are looking at it. The American Association of Hip and Knee Surgeons, which is an excellent source of information, has been proactive with this, and with both knee and hip replacement, we have been doing outcome studies before and after surgery for a long time, and there's a lot of information there. One of the unique things about knee replacement is that patients have a very significant impact on their own outcomes. You can't just go to a great surgeon and expect an optimal outcome. You have to put forth effort and participate in the outcome. Additionally, I think patients don't know what to expect. They don't know what their outcome should be or could be, and I think that is one of the driving forces between a separation from objective improvement and subjective satisfaction. Almost every patient that undergoes knee replacement is improved objectively, but a number of them are not satisfied. And why is that? I think it's because they don't know what their outcome should be or what to expect, and therefore their expectations may be unrealistic. So we look at this quite a bit in this section. I call it an interlude in the book. I think it's a very interesting and a unique thing, and very important for you to understand what to expect, what is a good outcome, what is a likely outcome. And it has a scoring system that you can actually score ahead of time and see kind of where you lie compared to the average patient approaching surgery, and see an average outcome after surgery. Additionally, there are topics kind of sparse or spaced throughout the book, such as when should I consider knee replacement? Not too early, not too late. We discuss risk balancing, particularly in terms of recovery, or after recovery, should I run? How should I follow my knee replacement? What should I do? How should I take care of it? All these things are present in the book, which I hope people will find very useful. So again, kind of in summary, this is an overview. I'll be populating additional videos gradually over the next month or two. Plan currently about 10 topics. Obviously, we're not going to cover the entirety of the book. I'm going to focus on some selective samples, and I hope this will add flavor to the book and enhance the reading experience. So I really encourage you to get the book. I wrote it to help patients. I really want to attract readers and help people. This isn't just about a monetary career after retirement. It's really focused on trying to help people have a better experience with knee replacement. So again, it's available on Kindle, Apple, Barnes & Noble, published on BookBaby, and a number of other sites. I encourage you to look at it, and if you're interested in knee replacement, I think it'll be very helpful to you. So I hope you guys have a great day today, and I'll see you at the next video, which the first topic I'm going to talk about is anxiety prior to surgery, which is a completely normal issue. This really applies to people having any significant surgery, not just knee replacement. So thanks again, and have a great day.